Everyone, we're going to go through on a few stretches, what I'm always telling you to do after massages. That's going to ease our pain, and that's going to bring back the joints and back to balance and the muscles back to balance. Here's Sandra. She's one of my competitor, and she's going to help me with these stretches. Now we are going to talk about the lower body. Lower body, because we're sitting a lot, people develop problems with piriformis, with the hamstrings, always run into this, they're always tied, and the psoas. The psoas gives a lot of lower back pain. So if you have lower back pain, I usually immediately aiming for the psoas, piriformis, gluteus medius, and the hamstrings group. Those are contributing to that kind of pain. Also, what I run into it in practice, a very tight gluteus medius and piriformis has an effect on the TFL. Can you stand up? Has an effect on the TFL that runs on the hip on the side, and the tendon of the TFL is the IT band, the so-called IT band. So when it runs down, a really tight IT band can cause knee problems. This is why when someone is complaining, someone is complaining on the knee, usually I immediately check the piriformis and the gluteus medius. How you can check those muscles? It is very easy. Usually you see everyone doing this in the gym, and usually see everyone doing it wrong. So when we're going to start stretching the hamstrings and the gluteus medius group, I always want an absolutely straight knee position, almost like you can even lock it without putting any pressure on it, because we're not lifting with it. So locking the knee at this position, it's considered safe. What I want is, when you grab a rubber band, you can put it around your feet and then just hold onto it one hand and then start pulling the hamstrings up. It's really important. That's when you see people stretching in the gym doing like this kind of motion and they're pulling forward. This is not going to stretch the hamstrings. It's more important to stretch that knee. It's more important to keep that knee straight and then coming up than coming all the way up with a bent knee. So I want this motion, and then from that moment you have to push that leg to the other direction out. As you see that when we're going in this direction, she's getting tight and tighter and tighter. So the gluteus medius is really tight, because this leg should be parallel with the floor all the way down. And this we have around 45-30 degrees of motion right here. Another really good stretch, what I always recommend, is the piriformis stretch. Usually the piriformis, you can feel it if you sit on it a lot, or you runners, or people who stand on one leg, so they develop usually just on one side. It's a big pain, or sometimes it's causing so-called pseudo-sciatica, which means the piriformis puts pressure on the sciatic nerve, and you're going to feel the tingling all the way down to the toes. When someone has this problem, usually it's not caused by different kind of herniation in the disc, or it's very rare. Most likely it's caused by the piriformis, so I always go and check for it first before an MRI can be done, determine that you have some kind of herniation in the disc. Stretching the piriformis is, you're going to grab the knee from outside. You can do it by yourself also, by pushing your knee to the opposite shoulder. Yes, just with one hand. So that's very important that you push into the opposite shoulder, not just up, not just in this direction, but diagonal up to there. And then you're going to, with the other hand, you're going to grab it right here at the ankle, and then you're going to slightly rotate around the knee. That's rotation, okay? It's really important while you're rotating, do not let the knee go. You still got to hold it down, and just a slight rotation. Good. I can show it from the other direction just as well. Let's check this leg out. As you see that it's a little bit bent right now, so I want to Totally stretch it out. I want to pull it in this direction. Good. And then from that side, you're going to go for the piriformis. Pull it in diagonal, and then grab it, and then lightly rotate that lower leg around the knee. You got to feel the stretch right in the middle of the body. Another muscle that's causing really big problems and a lot of lower back pain. Also, why is it really important? Because I really like to treat that muscle, because 90% of the cases, this is the muscle that's causing herniation in the lumbar section, L5, S1, or L4, L5. So when someone had that kind of problems, I immediately go for the psoas and check it out and see if it's really tight or not. Please turn on. Psoas stretch. You need a partner for that, because you cannot do it alone. You can do a few stretches with the psoas, but usually this is the best. The other stretches, what you can do alone, they're not as effective as this one. So when you work with the partner, the hands that closer to the person's head, it goes on the heels. The other hand that's farther to the person's hand, it goes under the knee. Okay? Now what I usually always do, you put your elbow down right above the sacrum, or right on the edge of the hip, and then you gotta aim with the heel to the opposite shoulder. Again, it's really important, not the same, to the opposite shoulder. When you do not put pressure on the hip. You just hold the hip down. Do not allow the hip coming up. That's all. But you don't lean on it. You don't push on it. Nothing else. And then you start lifting that knee, and then bring that heel to the opposite shoulders, and then stretch it out. Of course, we can do it on the other side. I do it in a different way because I want to show you. I don't want to cover my camera. So again, bring it down, and then bring it to the opposite shoulder, just like this. Here we go. And this is what you see. It's really important to put it down, because as you see that, you can see it from this side, the hips is lifting up. I can go all the way up. That's not good. You got to hold that hips down and then stretch it. As you see, I can't go as high now. It's now really stretching that muscle.